Good afternoon and welcome to Madison VA Hospital's live telephone town hall. Our leadership team is excited to hold this teletown hall with women veterans. My name is Tammy Town. I am the Madison Women Veteran Program Manager, and I'll be moderating this afternoon's call. Thank you for taking the time to join us. A panel of Madison VA's leadership team is here to provide information and answer your questions. We also have staff from mental health, whole health, community care, primary care, and several others to assist in answering your questions. Please note, for the next hour, we will provide information on a major city construction project that will likely impact entering and exiting our hospital. We also will provide information on the Annie application, Sister a Sister program, contraception therapies, new breast cancer guidelines, whole health updates, and more. In between updates, we'll have a live question and answer session. If you would like to ask a question, just press 0 on your phone, and you will be connected with a staff screener who will take your question and get you into the queue to speak with our panel. We hope you stay on the line with us and encourage you to participate in the question and answer session, which will take place, again, between the updates and at the end of the call. Again, to ask a question, just press 0 on your phone at any point during the call, and you will be connected with a staff person who will take your question and get you in the queue to speak with our panel during the question and answer sessions. We usually do not get to all of your questions, but you'll have the opportunity to leave us a voicemail and at the end of the call so we can follow up with you. If you do get disconnected from the call, unfortunately there is no way to rejoin, so please stay on the line. Now I'll turn over the call to our Hospital Associate Director, Mr. Abe Rabinowitz, for our opening comments.
All right. Well, thank you very much, Tammy, and welcome to all of our women veterans. We're thrilled that you're joining us this afternoon to participate in our teletown hall. First announcement that I have is, as you all may have seen in the media, and there's been a lot of media stories about restructuring and changes at the VA, that there is a plan in place for the department to begin a reorganization. And it is required that VA publishes this reorganization plan in June of 2025. So we don't have information on the specifics of this reorganization now, but we do anticipate further guidance as the date gets closer for that publication requirement. We want all of you to know, though, and to be confident that all of our women's health services are still available, and we absolutely, positively, 100% plan to continue caring for our women veterans. It is our highest honor, privilege, and sacred duty to provide care to you, and we strive every day to deliver the finest possible care that we can to all of you, and that will never falter. We also want to share an announcement today that the next inductee to our Hall of Heroes is U.S. Army Private First Class Dennis Stoppelworth, who lost his life while serving in Vietnam. The induction ceremony with his family will be held next Friday, May 23rd at 11 a.m., and we hope you plan to join us. I also have a construction update for you, as we are having a little bit of construction disruption in Madison that we want all of our veterans to be aware of. Beginning this week, the Madison Metropolitan Sewerage District began replacing critical wastewater infrastructure near the Madison VA Hospital that impacts Highland Avenue access from Campus Drive. The project began on Monday and will run through approximately September 5th. Of course, there are many factors that may bump this expected completion date, but we anticipate there being traffic delays trying to get in and out of the hospital due to this project, so please plan accordingly. The information about this traffic disruption is on our website, and you should have received this information in your email if you're subscribed to our newsletters, and if you haven't subscribed to our newsletters, please do so so that you can hear the latest from us. The city also has a website devoted to the entire project. So for all of you, access to the main hospital entrance and parking ramp from Highland Avenue remains open, and detour routes can be found online. We also have a map on the Madison VA website that should help you get a visual of where the disruption is and how you can continue to access our hospital. For details on the larger project, please visit the city's Highland Avenue Sewer Project page at madsewer.org/Highland. That's madsewer, madsewer.org/Highland. For VA-specific impact, please visit our external website, www.va.gov/Madison Healthcare. Again, the city's project site is madsewer.org/Highland, and our VA site is www.va.gov/Madison Healthcare. We appreciate your patience during this process, and I'm sure the city does too. We look forward to your questions later in the town hall, but I'll turn it back to you now, Tammy. Thank you.
Thank you, Abe. Next, we have updates from several of our programs. One program that is available to all veterans is called the Annie application. The Annie app is an automated messaging service that empowers veterans to take an active role in managing their health. You can register and subscribe to topics based on your areas of interest to receive automated text messages with self-care reminders, tips for reducing stress, instructions to prepare for your health care appointments, and more. A few self-subscribe applications include blood pressure and heart rate tracking, pain self-management support, sleeping difficulty, tinnitus tips, diabetic foot care reminders, weight management support, tobacco cessation support, and more. The primary benefit of Annie is the ability to receive different types of self-care reminders to improve your health. While Annie is primarily a text messaging service, you can also access features with the online version. Annie helps you take charge of your health one text at a time. To learn more about the various Annie apps, you can self-subscribe by going to the website mobile.va.gov/Annie. Again, that is mobile.gov/ANNIE. If you have any questions at all setting this up, you can reach out to the help desk at 866-651-3180. Again, 866-651-3180. Next, Dr. Maddie Weicker, our Women's Health Medical Director, has some updates on contraception options and availability.
Thank you, Tammy. Providing contraception is a critical component of routine care for veterans in their reproductive years. The full range of contraceptive options is available to veterans who use VHA for their care. We have hormonal and non-hormonal options, including oral medications, vaginal rings, injections, and long-acting options, including intrauterine devices and Nexplanon inserts. We can also provide emergency contraception and discuss permanent sterilization options. Many methods of contraception also have benefits beyond preventing pregnancies, including managing heavy or irregular menstrual cycles, endometriosis, and symptoms related to menstruation. Depending on your needs, your women's health primary care providers, the women's health clinical pharmacist, or one of our gynecologists can help you make an informed decision to consider your thoughts and feelings about having children, get information about the menstrual cycle and fertility, and learn how to be prepared for pregnancy and how to prevent sexually transmitted infections. If you are in need of contraception or have questions about your specific reproductive health needs, please reach out to your VA Women's Health primary care provider. I'd also like to inform you about an update on our new breast cancer screening guidelines. VA recently changed our breast cancer screening guidelines to now follow the United States Preventative Services Task Force, or USPSTF, breast cancer screening guidelines. The new recommendations are that women begin getting mammograms by age of 40 and can continue screening every other year through the age of 74. Women may choose to be screened annually or after the age of 74 after a discussion with their provider about risks and benefits. Did you know that 1 in 8 women will be diagnosed with breast cancer in their lifetime? VA provides screening mammograms to detect breast cancer early when it is most treatable. For women diagnosed with breast cancer, we offer full-service oncology treatment that includes imaging, surgery, chemotherapy, radiation, and other advanced state-of-the-art treatments as needed, either on-site or referred into the community. In addition, VA's National Breast and Gynecological Cancer System of Excellence combines research, partnerships with the National Cancer Institute, research universities, medical companies, and enhanced telehealth options for women veterans who are at high risk for cancer or who have cancer. This system provides the most advanced cancer care available and access to potentially life-saving clinical trials for all women veterans with cancer, even those who live in rural areas.
Thank you, Dr. Weicker. Next, we would like to provide you updates on whole health. Whole Health Care is the VA's approach to care, which supports and partners with veterans in living their healthiest, fullest lives. Whole Health Care focuses your values, asking what matters most in your life and what do you want your health for, while offering tools and skills promoting active self-care. As part of this whole health system in VA, the Integrative Health and Wellness Program offers a variety of services, such as health coaching, mindful meditation, Tai Chi, eating for whole health, yoga, and much more. We also have the Empower program for chronic pain self-management available at VA. This is an interdisciplinary service focusing on helping veterans live well with chronic pain and includes all the wellness services I just mentioned. If you're interested in any of the Integrative Health and Wellness and or Empower program for chronic pain services, please call us at 608-256-1901, extension 12537, and ask to schedule an introductory session. We have both in-person and virtual options available for both programs. Once again, the number is 608-256-1901, extension 12537. We look forward to being a part of your team on your health and wellness journey. Our next update before taking some calls in our upcoming Women Veterans is our Women Veterans Day event. Women Veterans Recognition Day is not a separate Veterans Day for women. The day recognizes, honors, and remembers the signing of the Women's Armed Forces Integration Act on June 12, 1948, allowing women the right to permanently serve in the regular armed forces. There is so much history about women veterans to be told, and it's important that our women continue to be recognized for their service and sacrifice. Women have served in America's wars and conflicts throughout our history. Today, women serve in all military occupational specialties. When they leave active duty, they should feel like they belong at VA. Please join us on June 12, 2025, from 4 to 6 p.m. at Lakeview Memorial Park in Middleton, Wisconsin, as we recognize and celebrate women's unique contributions to the freedom of our country. We will have 3 women veteran speakers, a picnic-style dinner, booths of information from VA and other veteran organizations, and many yard games to play with your friends and family. Again, that is on June 12th from 4 to 6 p.m. at Lakeview Memorial Park in Middleton, Wisconsin. All right, let's now go to some questions from all of you. Our first one is from Liz in Columbus. Liz, are you there?
Hello.
Hi, what question do you have for us?
My question is kind of a question and kind of a plead for women. I was curious when you planned, and hopefully you do plan at some point, to start providing or prescribing Wegovy for women. I can just tell you from my own experience, after taking Wegovy, I've lowered my A1C, I've lowered my cholesterol, and I can now move around and exercise. My physical well-being is greatly improved. My self-esteem has greatly improved. And there's so many things that being able to lose weight provides, and Wegovy is proven to do that for people. I paid for it. That's how important it was to me. I paid $4,000 out of my pocket because that's how important my health is to me. I wanted to lose the weight, and I wanted to lower my A1C, and I wanted to lower my cholesterol, and I wanted to feel better about myself. And that drug is like a miracle. I'm an advocate for anybody that wants to use it, and I'm just hoping that the VA will start allowing, prescribing that for people.
Hi, Liz. This is Dr. Amy Walsh. I'm one of the supervisors in primary care, and it sounds like Wegovy has brought you so many benefits, and I would say that is the case for many people. Now, the VA actually covers a medicine called tirzepatide or Zepbound. I'm not sure if you've heard of that one, but it's similar to Wegovy. You do have to have certain criteria met, and the start of that would be to talk to your primary care team, and they would coordinate with the pharmacist about those specific criteria to be met. But if you were to meet those specific criteria, then VA would cover that medication.
Yeah, I'm sure I won't meet the criteria anymore. I did meet, I think your BMI had to be like 29 or 30 and mine was like 28. So I did try and go that route and it didn't work for me. So I had to go to a civilian doctor to get a prescription for it and apply for credit cards and go to Walgreens and pay for it myself.
Oh, sorry about that. But keep asking your primary care provider, though, because there's a chance that these medications might become more available as time goes on.
Okay. I mean, I basically just wanted to be a cheerleader for the drug for, anybody else that wants to, work on their physical well-being, and it makes you feel great when you're losing weight and you feel, mentally you feel better about yourself as well.
Oh, for sure. It can be an important part of someone's overall health. Thank you, Liz.
And then just a reminder, if you want to ask a question, just press 0 and you'll be hooked up with our coordinators that will be taking your questions. We did have a question from an unknown person about the risks that would be affected at Madison VA. Abe, do you have any updates on that?
Yeah, I think the question was asking specifically for how many people would be affected, and there's really not an answer to that we can provide. We don't have information on a specific number of people that would be expected to be impacted here locally. In news articles, the Secretary has talked about returning VA globally from 470,000 to around 400,000, so a 10 to 15% cut, but has not been specific about how those reductions would occur and where specifically they would occur. One thing that he has been very consistent about is that they would not result in interruptions to patient care. So I think we're all kind of waiting to learn exactly what the details of the plan are. And once we have better information about what the exact impact would be for the Madison VA, it's certainly something that we'll share with all of our stakeholders. But with all of that said, we're really focusing on the statements he's made about not seeing reductions to care locally. So for all of you out there that may be concerned about whether or not we may still be here, we're very confident that we'll be able to be here and continuing to provide care for all of you.
Perfect. Thank you, Abe. I don't see any other questions currently, so we'll continue on with our updates. As a reminder, again, just press 0 if you do have some questions that pop up. Our next update is on military sexual trauma, and Karen Balke will be providing us with this update. She is our Health Promotion and Disease Prevention Program Manager.
At VA, we care for veterans that have experienced military sexual trauma, or MST. MST is a term used by VA to refer to experiences of sexual assault or sexual harassment experienced during military service. According to VA's National Screening Program, about 1 in 3 women and 1 in 50 men have responded that they have experienced MST. Although trauma can be a life-changing event, people are often remarkably resilient after experiencing trauma. Many individuals recover without professional help. Others may generally function well in their life, but continue to experience some level of difficulties or have strong reactions in certain situations. For some people, the experiences of MST may continue to affect their mental and physical health in significant ways, even many years later. VA is strongly committed to ensuring that MST survivors have access to the help they need in order to recover. In fact, all treatment for physical and mental health conditions related to experiences of MST is provided free of charge. To receive free treatment for mental and physical health conditions related to MST, veterans do not need to be service-connected. Veterans may be able to receive this care even if they are not eligible for other VA care. MST-related services are available at every VA medical center, and MST-related counseling is also available through community-based vet centers. The Madison VA additionally has a couple support groups to help veterans in their recovery. One group is called Women's Courage. This is a group for female veterans to support one another in recovery from sexual trauma, whether it occurred in the military or civilian life. It is a 10-week program with 90-minute sessions. This group does not focus on the exact trauma or discuss it in a group, but rather focuses on dealing with thoughts, emotions, and relationship patterns that often follow from interpersonal trauma. A new group will be starting at the end of July. Another group Madison VA has is Sexual Healing and Intimacy. This is a 10-week group for women veterans to learn more about how sexual trauma has impacted their sexual health and well-being. Participants will learn skills to improve self-trust and sexual healing. Participants will also learn communication skills to enhance feelings of trust and safety. The next start date for this program is June of 2025. If you would like to participate in the Women's Courage group or the Sexual Healing and Intimacy group, please talk with your mental health provider for a referral or contact the mental health clinic at 608-280-7084. Again, that is 608-280-7084. Another helpful resource is the Beyond MST application. The Beyond MST app is a free, secure, and private mobile application created for MST survivors, with input from MST survivors and other key stakeholders. It has over 30 specialized tools and other features to help MST survivors cope with challenges, manage symptoms, improve their quality of life, and find hope. Any personal information entered in the app is private and is not shared with anyone, including VA. For more information on MST, please feel free to reach out to our MST coordinator, Casey Hoffman, at 608-256-1901, extension 11857. Again, Casey's phone number is 608-256-1901, extension 11857.
Thank you, Karen. Our next speaker is Jennifer John Cox, our Suicide Prevention Coordinator.
Hello. Preventing veteran suicide is a top clinical priority for VA. One of the ways we can do this is by increasing the time and distance between a person in suicidal crisis and their access to lethal means. The VA Keep It Secure program promotes awareness about the simple steps you can take to protect yourself and your family. You can find information such as how to secure firearms, safe medication storage, as well as support for veterans and families who are experiencing a suicidal crisis. Find more information at www.keepitsecure.net. That address again is www.keepitsecure.net. In addition, your Madison VA provides cable gun locks for veterans and the community free of charge. If you are interested in cable gun locks, ask at the clinic next time you are in, or you can request them through your primary care team. As always, veterans can reach out to the Veterans Crisis Line for free, confidential support 24/7. You can reach the crisis line by calling 988, pressing 1, texting 838-255, or by using the chat feature online at veteranscrisisline.net/chat. That information again is by calling 988, press 1, texting 838-255, or by using the chat feature online at veteranscrisisline.net/chat.
Thank you, Jennifer. Our final update is on our Sister a Sister program. At Madison VA, we have a program called Sister a Sister, where women volunteers assist women veterans from the front door of the clinic or hospital to their scheduled appointments, as well as during an appointment if that is requested. We are currently seeking women veteran volunteers to be Sister Assisters to increase our volunteer pool. If you are interested, please leave a message after this call, or you can reach out to Tanya Salas, our Sister Assister Coordinator, at 608-256-1901, extension 18584. Again, that is 608-256-1901, extension 18584. If you're interested in receiving Sister Assister services, please call a different number to be connected with a Sister Assister for your appointment. Please note that we ask you to let us know at least 7 days before your appointment so we can ensure we have a Sister Assister available for you. The Sister Assister phone number is 608-256-1901, extension 13440. Again, that phone number is 608-256-1901, extension 13440. When you call this number, you will be prompted to leave a message with your name, last four, phone number, date, time, and location of your appointment. I do have one question that came in, and they were asking about the Annie application. They just wanted the website again and the phone number. So that website for the Annie application is mobile, mobile.va.gov/ANNIE. So again, that's mobile, mobile.va.gov/ANNIE. For the phone number, which is the help desk for Annie, that is 866-651-3180. Again, that phone number is 866-651-3180. All right, let's go back to questions. We have Rhonda from Freeport. What question do you have for us today, Rhonda?
Hello. I'm calling because I'm really advocating for women with breast cancer to be able to receive cryoablation treatment for their small tumors, which are under 2 centimeters. I've been a candidate with breast cancer now for 4 years, and I'm supposed to get a lumpectomy, but I've been holding off in hopes that cryoablation would be approved for women. And I was hoping that the VA could consider this because cryoablation is already approved to treat prostate cancer in men. And I would like to see women be offered the same non-invasive treatment for their breast tumors because this would eliminate cutting and stitching and removing a whole lot of tissue. I just think it's really important for women to be able to be offered this. It has been in a trial called the ICE Cure. I think it's been going on since 2021, and they've been having amazing results of 98% effectiveness with very little recurrence, and it's about as effective as surgery. And so I'm just wondering if the VA would be open to letting women choose this. And another thing is it's supposed to be less expensive than surgery, and it's an outpatient procedure. I don't know if people know, but it's freezing of the tumor, which kills it. And so that's my question. I was hoping VA would be open to allowing this for women.
Hi, this is Dr. Marsh. Sure, yeah, go ahead. Okay, sorry. This is Dr. Marsh. I'm the Chief of Staff here at the VA, and thank you for your comments. We do have some restrictions here at the VA with it has to be FDA approved. We certainly have access to trials, and we have an amazing oncology team here. And if this is appropriate for your care, that we could consider sending you to a trial. And so this would be something to discuss with your treating oncologist. if that would be appropriate for your care. But unfortunately, we are somewhat limited in that it has to be FDA approved for us to offer it.
All right. Thank you, Rhonda. Next up, we have Librata from Rockford. Librata, what question do you have for us today?
Hi, yes. Good evening. My question, I know that you are doing some restructuring, and one of the programs that's being lost is the Moving the Body program. There's twice a week, there's a co-ed class, and then there's a women's only class, and it's a wonderful program. I'm very, very sad to see it go. It fills a niche for people who have restrictions, either due to weight or age or, illnesses. And I just want to know, what are you going to be replacing that with? Where do we go if this is the program that worked for us? Because I know GeroFit is for 65 and older, and some of us don't fit the age range, but it's also faster paced. So some of us with those restrictions can't seem to keep up and feel comfortable in that class. So I'm just wondering, what is our next option, and where do we go to find it?
Hi, Librata. This is Sarah Fraser. I'm a clinical social worker, and I work with Women's Health and the Mental Health Clinic. I really appreciate your comments, and I'm glad that Moving the Body has been so helpful for you. And it sounds like perhaps you got into the group through the Whole Health and Integrated Health and Wellness System. Does that sound about right?
Yes, that is correct.
Do you have a health coach that you're working with currently, on an individual basis? Okay. I think
she's the one who was heading the class.
Right. That's helpful. I would definitely talk with your health coach about some alternative options. I wasn't familiar that this group was ending or that it wasn't no longer being offered, but I think that would be your best source to ask about alternatives or some other options. And perhaps, I definitely appreciate your comments about it being individualized and something that would be really helpful. So I think that would be the first source I would go to, is to talk with your individual health coach about options.
Okay. We currently don't have another program just like that, but there is a program that hopefully in the near future will be being developed called VetFit. And so that will be opened up for a broader age group, so pretty much all ages, not just GeroFit. And so that's something that we can work on, hopefully trying to create something that is a little bit encompassing what your desires are too. So I'm definitely holding a couple focus groups with Move the Body group and hoping to get some great input from the veterans so that we can collaborate with the GeroFit people and create something that will be beneficial for all of our veterans. But unfortunately, it'll probably be a little bit of a wait before then. I do know there are some online fitness programs, too, that Whole Health has. So I do agree with Sarah, contacting your health coach. There may be a couple other options available, but unfortunately, Move the Body is coming to an end. All right. Great question, Librata. So next up, we have Robin from Madison. Robin, what question do you have for us today?
Hi, good evening, everyone. It seems like the last three people, all of our names have started with R. I love it. I'm kind of piggybacking on the very first question in regards to using Armour Thyroid to treat hypothyroidism. I was diagnosed with Hashimoto's and hypothyroidism in 2012, and immediately got put on Synthroid, and then discovered I was allergic to it, and then got put on levothyroxine, discovered I was allergic to that, if it was a blue pill or a green pill, and then they finally found a white pill, but then you have to take them only in certain dosages and do pill cutting. Fast forward to about a year and a half ago, I finally got on Armour Thyroid, and I have not felt better than when I got on Armour Thyroid. And I talked to Dr. Walsh, as my primary care provider, and she said that they don't offer it through the VA. And I'm hoping that's a yet, but I don't know. And I was just wondering if, I have, for the last 13 years or whatever it was, on levothyroxine, I have felt like a humming underneath my skin, like I was buzzing, like I was constantly being stung by bees, and it felt like I was possibly allergic to levothyroxine that's supposed to be helping me with my thyroid. And I didn't realize that until I got off from it. And then a bunch of the anxiety subsided, a bunch of the feeling just run down and bloated and stuff. So anyway, my question is Armour Thyroid a possibility of being approved by the VA?
Thank you so much for your question. This is Dr. Holly Eisenhower. I'm from primary care here at Madison, and it does sound like it's been a long and bumpy road at times. Regarding your specific question, at this time, Armour Thyroid is not approved by the FDA as a thyroid supplement, and so that does place some limitations for us at the VA. Different patients, of course, are going to have different reactions to medications at times, and it sounds like you've gone to your primary care provider. Of course, that's an option again. We do have an endocrinology section here as well that treats thyroid disease, including, advanced issues in thyroid, and so I think there's some resources here to kind of further look at what kinds of problems you're having and how we might be able to help you.
Thank you. I appreciate your response.
My pleasure. I wish you well.
All right, thank you, Robin. So next up we have Helen from Beloit. Helen, what question do you have for us?
Well, it's not so much a question as a praise for the GeraldFit program. Because I've been on the GeraldFit program, I've lost 30 pounds. But it's a great program for the people, for us, and the kids that work the program have done an awesome job at keeping us enthusiastic about the program itself. It's like sometimes you get up in the morning and you don't want to do exercise, but you don't want to miss it. It's been a great program for me, and it's helped me a great deal. That's basically all that, I just wanted to praise the program.
Thank you, Helen. That's amazing, and so happy for you, and great shout out to our GeraldFit program. It is a fabulous program, so definitely check that out if you haven't. All right, next up we have Cindy. Cindy, what question do you have for us?
Hi, can you hear me all right?
Yes, we can hear you.
Okay, so the first question is the lady that spoke about breast cancer and treatment. Could that be available through community care since the VA does not currently provide it?
You're a little soft. Are you asking if it's available through community care, breast cancer research?
Correct. Yep.
Hi, Cindy. This is Melissa. I'm the Chief of Coordinated Community Care, and our services that are approved through community care are the same that are approved at the VA. So it would need to be FDA approved to be covered in the community as well.
Okay. My second question is about the VA hospital in Middleton, of which I'm very proud of my providers and very thankful for each one of them. There is, however, a mental health shortage, however. One retired, one left, one is very ill, and I don't know about number 4. So 4 providers. So I know that I'm not receiving care, and I assume, and I haven't received care for almost 4 months. And so, and that's concerning because I have clinical depression. But I wondered, I found out today that it was not due to layoffs, but I wonder what the VA's plans going forward are to meet the needs of the veterans who have designated disabilities of concern. Certainly they have a plan. They're not just going to leave us, in a situation going on 5 months.
Hey, sorry, this is Dr. Marsh, Chief of Staff here, and I'm sorry that this is happening. I'm trying to figure out, are you saying at the central building here at the main hospital is where you've lost these providers?
Yes, my provider for mental health is at the Middleton or Madison Hospital, and looking in why someone could not fill in for my provider who is very ill, I found out that there are 4 providers that are not available at the current time, and they could provide me nothing. So I'm wondering what the plan is, because we're talking 4.5 months now, and I was heavily pressured, I'm going to use that word because it was, to bring all of my care to the VA and stop it through the SSM. And so I did that to bring all my care under one umbrella as a disabled vet. So this is concerning to me because I dropped my outside providers, and there's a turnaround time to get those providers reinstated or finding other ones. So I want to know what the plan is to help those of us affected by the 4 providers who are no longer working or able to work at the VA.
Okay, so sure. And again, I'm really sorry that is happening. I believe at the end of this call, you can leave your contact information. So I'm going to strongly encourage you to do so that we can look specifically at what's going on in your case, because we have a robust mental health department here. We have tons of providers. We have providers, unfortunately, who have to take leave, and we cover for them. So if there's something going on there, we need to know about it. So I strongly encourage you to do that, okay?
And I'm glad to do that. I have self-advocated every month. And I have sent messages, and I have talked to people. So I would be very much appreciative to give you my information.
Absolutely, absolutely. And thank you for your service.
All right. Thank you, Cindy. All right. Next up, we have Laura from Poynette. Laura, what question do you have for us? Okay, Laura, are you there? We have well, I'll just read it. So Laura had a compliment, a shout out. I want to say, as a sexual assault victim, the service I receive from you are all very, very helpful. The classes build confidence, character, and teaches you to focus on good and bad rather than negative. I want to encourage others to give it a try. Whether a man or a woman, we need to stay together as a team and support one another. That is so wonderful, Laura. Thank you so much for those comments. Next up, we have Kathy from Rockford. Kathy, what do we have from you today? Looks like another good comment. So just wanted to give a shout out to Sarah, my therapist. Kudos, Sarah.
Thank you, Kathy. Good to have you on the line.
All right. Next up, we have Bianca. Bianca, what question do you have for us today?
Hi, I am a veteran who is also still in the Army Reserve. I have been getting all of my mental health care from the VA for a little bit now. Unfortunately, I was recommended for a medical board review through the military against my will. So basically what that is they decide whether they want to retain me with restrictions, or kick me out based on my mental health. During the appointment where I was notified that this was going to happen, the provider pulled up some of my VA records. So I know that they can access my records, but I don't know how much they can see. So it's kind of put me in an awkward position where my success with treatment depends on my ability to trust and feel comfortable with my providers. But I also know that the Army can see some of what I tell my providers and may kick me out based on what I say. So I guess I'm just wondering, like, how much the military can see of what goes on in my VA mental health care treatment, because I know they can see something, but my providers don't seem to know how much, which is fair. And I guess I'm also wondering what other resources may be available. I know there's some options for non-medical counseling, but that can't be viewed by the military. But I'm also wondering if there's any resources for more advanced care as well.
Hi, Bianca. This is Stephanie. I'm the Chief of Social Work here at the Madison VA. That is a really great question, but first I'd like to say thank you for coming in and getting treatment for your mental health care. I think that's just as important as every other kind of care that you can get, so I'm very proud of you for coming forward and getting that needed care. I don't actually know the answer to your question, so I will give the same advice that we gave the last caller, which is to please leave a message, and I will specifically look into your situation, and because I think it's a really great question that I would love to know the answer to, just generally speaking. The other thing that I just wanted to mention is there is the vet center, and so if you feel like the VA and the Department of Defense maybe has too close of ties, some veterans feel more comfortable going to the vet center because it's a little bit more removed. Now, we still collaborate with the vet center, but that might be another avenue to get some mental health and some advice if you would feel more comfortable. The vet center started as a grassroots effort and really started out kind of as an alternative to getting some services through the government and Big Brother watching. So I think it's probably a good option to explore. When you leave your message, you can let me know where you're from, and I'll get you hooked up with a number for the vet center closest to you, because we have them in Illinois and Wisconsin. Thank you.
Thank you, Bianca. Our next question is from Carol in Baraboo. Carol, are you there?
Hi, yes, I am. My question has to do with finding a CFS or chronic fatigue syndrome provider, because so far nobody that I have run into at the VA here in Wisconsin knows anything about chronic fatigue. And I was being treated in Colorado up until about a year and a half or 2 years ago. And I was seeing a private provider who diagnosed me 10 years ago based on symptoms, blood work, and a SPECT scan of my brain. And I can't find anybody in Wisconsin, and I will go outside the VA if I have to, and I will pay out of pocket if I have to, because the symptoms are starting to really affect me again. So I was wondering, is there anybody in the VA that knows anything about chronic fatigue syndrome?
Hi, Carol. This is Dr. Walsh again. It sounds like you've had some really great care for chronic fatigue syndrome. Here at the VA, it would start with talking to your primary care provider. A lot of times rheumatology is looped in with symptoms such as are experienced in chronic fatigue syndrome. We also have a post-acute COVID or long COVID provider that treats patients with this post-acute COVID, which is similar to chronic fatigue syndrome. We also have a special physical therapist dealing with symptoms like chronic fatigue syndrome. So those are some of the options. I'm going to have my colleague, Dr. Eisenhower, step in too.
Dr. Holly Eisner from Primary Care again. Also, though I don't know, of course, any specifics from you, ma'am, but chronic fatigue syndrome is one of the lists for unexplained symptoms. So depending upon when and where you served, that's another piece that could be explored in your care. So I did want to encourage you to maybe return back to your primary care provider with a kind of a further explanation, and then we do have resources to try to move things forward and explore better to help you.
Okay, so my primary care provider, who just recently left in the Baraboo Clinic, she knew nothing about it. I showed the stand-in my. I brought in all of my reports and diagnoses and everything from my private provider, and it just nobody, and they were unable to help me.
You know, Carol, why don't you leave your contact information, and then we can further look into your case and try to help guide your care a little better.
Okay, thank you so much.
Thank you.
All right, that is all the questions we have in queue, so we will wrap up for today. If you didn't get to your questions, please stay on the line. In just a moment, you'll have a chance to leave a voicemail with your questions, comments, and feedback. I do want to provide one reminder for all of you is our Women's Veterans Day event. That is June 12th from 4 to 6 p.m. at Lakeview Memorial Park in Middleton, Wisconsin. So again, mark your calendar for June 12th from 4 to 6 p.m. at Lakeview Memorial Park in Middleton, Wisconsin. So again, feel free to leave a voicemail at the end of this call with your questions, comments, or feedback. Please note we have recorded all the questions and will make sure that everyone who raised a question and has not received a response or needs follow-up will receive a response. We plan to get back to you with a response within the next several weeks. Thank you for joining our Teletown Hall. Have a great evening.